The Special Pathogens Biopreparedness Map is one of the most comprehensive public dashboards available for monitoring infectious diseases and high-consequence pathogens around the world. What makes this platform especially valuable is that it combines outbreak intelligence, epidemiological context, and official public health resources into a single, highly accessible interface. Rather than focusing on one specific disease, this dashboard provides a broader view of global health threats. It allows users to explore outbreaks, endemic diseases, and regions of concern involving some of the most important infectious diseases known today. This includes viral hemorrhagic fevers such as Ebola and Marburg, as well as diseases like mpox, cholera, measles, polio, yellow fever, avian influenza, and many others. In practical terms, this means that a single platform can offer a global overview of multiple diseases that continue to affect public health and, in some cases, international security. The dashboard is part of a broader preparedness initiative developed by the Special Pathogens program at NYC Health Plus hospitals. That institutional background is important. It indicates that the platform was created with a strong focus on clinical readiness, public health response, and evidence-based information. The term biopreparedness refers to the ability of healthcare systems and public health agencies to identify, contain, and manage dangerous infectious diseases. Preparedness includes surveillance, laboratory testing, training, protective equipment, communication systems, and international coordination. The goal is to detect potential threats early and respond quickly enough to reduce their impact. This dashboard serves as a practical tool for supporting that process. It brings together data, maps, and educational resources that help transform complex information into situational awareness. Situational awareness is the ability to understand what is happening, where it is happening, and why it matters. That concept is fundamental in public health, emergency management, and intelligence analysis. One of the most useful aspects of the dashboard is that it distinguishes between different epidemiological contexts. Some diseases appear as active outbreaks. Others are shown as endemic. An outbreak refers to an increase in cases above what is normally expected. Endemic means a disease is regularly present in a particular region. This distinction is essential. A disease may be serious and persistent without necessarily representing a new emergency. Understanding that difference helps avoid misinterpretation. Another important concept is that maps show information, but they do not interpret it automatically. A marker on a map is a signal. It points to a location associated with a disease event, surveillance update, or official report. but the meaning of that signal depends on context. How recent is the information? What source reported it? Has it been independently confirmed? Is it an isolated event or part of a broader trend? These are the kinds of questions that professional analysts ask. This is where the dashboard becomes especially useful. It does not simply display data. It encourages a structured way of thinking. It helps users move from observation to interpretation. That analytical approach is very similar to OSINT. Open source intelligence is the process of collecting and analyzing publicly available information to produce useful insights. In epidemiology, the same principle applies. Official reports, news articles, laboratory updates, and surveillance bulletins are combined to form a clearer picture of emerging health events. One of the most important lessons in outbreak analysis is that more visible data does not always mean more disease. Sometimes it means better surveillance. Countries with stronger laboratory networks and more transparent reporting systems may appear more active simply because they detect and publish information more effectively. Conversely, regions with limited diagnostic capacity may appear quieter even when significant transmission is occurring. This is known as reporting bias, and it is one of the most important concepts to understand when interpreting global health data. The dashboard also highlights how interconnected the world has become. An unusual cluster of cases in a remote area can be investigated locally, confirmed by a reference laboratory, and reported internationally within a short period of time. That information may then appear on public dashboards viewed by researchers, journalists, and analysts around the world. This rapid flow of information is one of the defining features of modern public health surveillance. The diseases included on this platform vary widely in how they spread and in the risks they pose. Ebola and Marburg are severe viral hemorrhagic fevers. Cholera is typically associated with contaminated water and sanitation challenges. Measles is one of the most contagious viral diseases known. Polio remains a concern in certain areas where vaccination coverage is incomplete. Avian influenza is closely monitored because some strains have pandemic potential. Mpox, yellow fever, and Lassa fever each present distinct epidemiological challenges. Despite these differences, all of these diseases benefit from timely surveillance and effective response. That is why a unified dashboard is so valuable. It allows users to compare very different pathogens within a common analytical framework. Another compelling feature is the educational value of the platform. In addition to mapping disease activity, it provides fact sheets, clinical guidance, and links to official resources. This makes it useful not only for experts, but also for students and anyone interested in understanding global health more deeply. A well-designed dashboard can reduce complexity without oversimplifying reality. It makes important information easier to explore while preserving the underlying context. This balance is difficult to achieve, and it is one of the strengths of this platform. From a strategic perspective, infectious disease monitoring has implications far beyond medicine. Outbreaks can strain healthcare systems, disrupt schools and businesses, affect tourism, and place pressure on governments. In severe cases, they can alter trade, travel, and public confidence. This is why disease surveillance matters to policymakers, researchers, humanitarian organizations, and risk analysts. The map also illustrates a broader truth. Public health is global. Pathogens do not recognize borders. Local events can have international significance. An effective response depends on collaboration among clinicians, laboratories, governments, and international institutions. That cooperation is one of the most important defenses against emerging biological threats. Another point that is often overlooked is that dashboards reflect both biology and infrastructure. They show where diseases are being detected, but they also reveal where monitoring systems are strong enough to identify them. In that sense, a map is also an indirect picture of surveillance capacity. Better data often reflects better preparedness. And better preparedness can save lives. Ultimately, the greatest value of the Special Pathogens Biopreparedness Map is that it makes complex global health information easier to understand. It brings together outbreaks, endemic diseases, trusted sources, and practical context in one clear interface. It helps users see where important health events are occurring and understand how modern surveillance systems work to detect and respond to them. And in doing so, it offers a deeper appreciation for the science, logistics, and international cooperation required to protect global health.